Good morning, everyone. I'm Dr.Sandhya Gunnal, Associate Professor from Department of Anatomy, Rural Medical College, PIMS-Loni. So I'm here to discuss with you the histological features of the lip, tooth, and tongue according to the practical point of view. So we have already studied the theoretical aspect of the histology of the lip, tooth, and tongue. The oral cavity constitutes the lips, teeth, and the tongue. So first we'll discuss about the lip. So this lip is a large fleshy fold. It is formed by the skeletal muscle present in the central core, forming the central core. It has the outer aspect formed by the skin and the inner aspect formed by the oral mucosa. Okay, so section passing through the lip here, the section passing through the lip, it looks like this. Here, this is the fold of the lip. Its central core here, this is the central core, here this is the lining of the central core, here this is formed by the skeletal muscle. Here the skeletal muscle is cut transversely. The muscle is the orbicularis oris muscle. Then you are knowing the structure of the muscle, the histological feature of the muscle, that how it looks like, its transverse section, its longitudinal section. So here one can find out that this is the transverse section passing through the skeletal muscle, which is forming the central core of the lip. Here this is the end of the lip. It is the transitional zone of the lip, or it is also called as the red zone. Okay. Now these are the two lines, these are the two aspects here, one of the covering here, that is the external covering of the lip, and one of the covering, that is the inner covering. Okay, so out of these two coverings we should identify that which is the outer one and which is the inner one. Okay, so we are knowing that the outer aspect, it is the skin. So we should know the epithelial lining of the skin. So the epithelial lining of the skin, that is the stratified squamous keratinized epithelium. Okay, so out of these two, here I can find out here, this is the stratified squamous keratinized epithelium. On one side here there is the stratified squamous non-keratinized epithelium. Okay, so here this is the keratinized epithelium, so this is the outer aspect. Now the another easy aspect to identify here, the outer and the inner aspect, that inner covering, that is the outer covering, the skin, it is along with the hair follicles. Hair roots, hair follicles are there along with the outer covering. So that will be easier to identify the outer aspect of the lip. So here this is the outer covering of the lip. It is formed by the skin. It shows the stratified squamous keratinized epithelium. Along with this, there are the presence of the hair roots, hair follicles. Along with the hair follicles, one can find out here, there are the number of glands present there. There are the sebaceous glands, there are the sweat glands. Okay, so here this is the epithelium. Underneath the epithelium here, there is the dermis. It shows the presence of the hair roots. Along with the hair roots, there are the erector pallidum muscle, there are the number of sebaceous glands. Okay, so here this is the outer aspect. Now this is the inner aspect present there. This is the inner covering of the lip. It is covered by the oral mucosa. So oral mucosa is lined by the stratified squamous non-keratinized epithelium. Okay, so this is somewhat thicker than that of the skin covering. This is devoid of the hair follicles. Here there are the hair follicles along with the outer aspect. Now along with this stratified squamous non-keratinized epithelium, underlying that there are the presence of the connective tissue. Okay, so here this is the connective tissue present there, that is the lamina propria, and underlying that here, along with this inner aspect, there are the number of labial salivary glands. So here one can find out here, there are the presence of the labial salivary glands. Okay, now here this is the transitional zone or the red zone. Okay, so here this red zone or the transitional zone present here at this point, there is the stratified squamous keratinized epithelium, and here it is becoming the stratified squamous non-keratinized epithelium. So this junction present here at this point, it is called as the vermilion border. Okay, so this is the vermilion border, and this zone present here is the transitional zone. Now this epithelium, which is thinner one, it is becoming thick, and now it is having the proper thickness, the uniform thickness here. So this portion where it is becoming the thicker and thicker when it is going towards the inner aspect, so this is called as the transitional zone. Now underlying this transitional zone here, there are the presence of the number of blood vessels. So these blood vessels, it gives the red color to this transitional zone, and that's why this portion, this free end of the lip, it is also called as the red zone. Okay, so here this is the structure. This is the outer covering, which is lined by the skin along with the hair follicles and that of the number of glands. The sebaceous and the sweat glands are there. This is the central core of the lip. It is formed by the skeletal muscle, which is transversely cut. The muscle name is the orbicularis oris. At the end of this, there is the red zone, which constitutes the number of blood vessels. Inner aspect is lined by the stratified squamous non-keratinized epithelium, which is forming the oral mucosa. Underneath that, here there are the number of labial salivary glands. Okay, so this is the structure of the lip. We'll make it zoom. We'll make it zoom here. Okay, so here this is the picture of the lip. Here this is the stratified squamous keratinized epithelium. Here these are the hair roots present here. These are showing the numerous glands. Here one can find out there are the number of glands. Now here again deeper to that, there is the muscle, which is transversely cut. On this side here, there is the stratified squamous non-keratinized epithelium, here the connective tissue core, and here these are the numerous labial salivary glands. Okay, now we are tracing here the end. Here the stratified squamous non-keratinized epithelium. Now here it is becoming thin and thin. Now here this is the junction between the stratified squamous keratinized and non-keratinized epithelium. So here this border, it is the vermilion border. Here there are the numerous blood vessels seen underneath the red zone or the transitional zone. Okay, so this is the picture of the histological picture showing the structure of the lip. Okay, now we'll go to see the slide, how the slide looks like. Okay, so here this is the histological picture of the lip under the 5x magnification. This is the low power view under the 5x magnification. So here one can find out that this is one of the end present there, one of the aspect, the outer aspect there, that this epithelium is the stratified squamous keratinized epithelium. Okay, so this is stratified squamous keratinized epithelium. Here you can find out there is the presence of the hair follicle. Okay, so hair follicle, it makes it easier to identify the outer and the inner aspect. Okay, so here this is the hair follicle. Along with the hair follicle, you can find out here this is the sebaceous gland. Okay, so here this is the epithelium is there. Under the epidermis here, there is the dermis, which shows these number of glands present there, and here there are the presence of the muscular layer. Here the muscular layer is seen. Okay, so here we cannot confuse the structure of the slide of the skin along with the lip, as this skin, it shows the presence of the epidermis and dermis, but here underlying the dermis here, there is a regular thick layer of the muscle, and underlying the muscle here there are the labial glands and followed by the inner layer of the lip. Okay, so here the low power view, the 5x magnification of the histological features of the slide here. Now here will see the next slide here, that is the 10x magnification of the lip. Okay, so here this is the outer aspect. Here this is the outer aspect. It's covered by the stratified squamous keratinized epithelium. Here is the hair root present there. Now there are the number of blood vessels seen here. There are blood vessels present here. These are the number of glands seen here. These are the sweat glands present here. Along with the hair root, one can find out here there are the sebaceous gland. Okay, so here in this view, in this much magnification, one can find out only here, this is the outer aspect. When we trace the slide and again see here the deeper aspect, it is followed by the muscular layer and it is followed by the inner aspect. Okay, so here this picture, it is showing the outer aspect of the lip. Now this is the next slide present there. It is showing the inner aspect along with the muscular layer. Again, this is the 10x magnification. Here one can find out this is the inner aspect. It is lined by the stratified squamous non-keratinized epithelium. Okay. Now you are underlying that here there is the connective tissue. Along with the connective tissue, one can find out here there are the presence of the labial salivary glands. Here this is the gland. This is the portion showing this is the tissue of the labial salivary gland. Here again the labial salivary glands are there. This is the connective tissue. Now deep to this, these layers present here, these are the muscles. Muscles, these are transversely cut here. Okay, so we have seen the lip. Now here, this is the musculocutaneous junction. This is the mucocutaneous junction. So this is the mucous membrane present here. This is the mucous membrane, thick mucous membrane is there. This is the stratified squamous keratinized epithelium. Okay, this is the cutaneous part and this is the mucous part. Okay, so here this is the junction present here. At the junction here, you can find out here these are the folds. Actually, this is the artifact here. This is the mucocutaneous junction, the mucous membrane and the skin. And underlying here in the connective tissue, you can find out there are the numerous blood vessels. Okay, so we have seen how the slides of the lip looks like. Now here you have to draw the structure of the lip in your journal. So this is the departmental card showing the lip. This is how you have to draw the lip in your journal. So here it is showing here, this is the picture of the lip. Here this is the central core. It is formed by the muscle, the orbicularis oris. Here is the outer aspect of the lip. It is along with the hair follicle here. It is lined by the skin. Here the skin. Then this is the vermilion border. The red margin. This red zone starts here, the transitional zone, which becomes here. It is continuous with the mucous membrane. This is the mucosa, oral mucosa. Underlying the oral mucosa, here there are the number of labial glands. Okay, so we have seen here all the features. The outer aspect, there is the skin. Then there is the vermilion border, that is also called as the red margin. This hair follicles are there along with the skin. Along with the hair follicles, there are the presence of the sebaceous gland. Here, these are the sebaceous glands. Sebaceous gland, you can also find out the sweat glands in it. Then the central core, that is the orbicularis oris muscle, the skeletal muscle, transverse section is there. Then there are the labial glands. Here these are the labial glands. Then lastly here there is the prominent retirete system. Here this papillae these are interlocking here the mucous membrane. Underline that here. These are the retiary system. These are holding the mucosa in place. The mucosa is lined by the stratified squamous non-keratinized epithelium. Okay, so this is the picture you have to draw in the journal. Now I'll go to the next part, that is the teeth. The teeth are placed in the oral cavity. These are present forming the upper jaw and the lower jaw. These are forming the joint here with the gum, that is the gomphosis type of joint, that is the pay-gain socket type of joint. Okay, so you can find out here the three main parts of the teeth. Here this is the outer part of the teeth, that is the crown. Then here this is the neck of the teeth and the root portion which is embedded in this gum. Okay, so we'll see here the gross feature, the macroscopic feature of the teeth. Okay, so here these are the three main parts. Here the outer part which is visible, that is called as the crown. Here is the neck, and this is the root portion which is embedded in the jaw, in the gum. Okay, so here this is the root part, this is the neck part, and this is the outer part called as the crown. Okay, so the crown of the tooth, it is covered by the hardest material, that is called as the enamel. The main portion of the teeth, it is formed by the dentine. Here this is the creamish yellow structure seen here, that is the dentine. The crown portion of the dentine is covered by the enamel. The cavity of the dentine is called as the pulp cavity. Okay, so these are the parts present in the crown. I'll discuss about the root portion present there. So in the root portion, again the main part present here, that is the dentine. The cavity of the dentine, that is the pulp cavity. The pulp cavity, it becomes narrow and it is called as the root canal. This root canal, it opens here at the apical portion, the apical canal. Instead of the enamel, in the root here, the dentine is covered by the cementum. Okay, so here this light pinkish structure seen here covering the root portion of the dentine, that is the cementum. The cementum, it is joined here with the jaw by the periodontal membrane. There is a periodontal ligament. Okay, so here this is the lower jaw, it is covered by this gums. Okay, so this is the structure of the tooth. We'll see here the macroscopic features of the tooth. Here you can find out here the outer portion, it is covered by the enamel. This light yellow, that is the dentine, and here this inner cavity, that is the pulp cavity. This much portion present here, that is the crown, and here this is the root part of the teeth. Okay, so enamel which is present here, that is the thickest material, that is the 99% of the inorganic salts are there, the hydroxyapatite crystals are there. These cells, these are rod shaped cells, these are also called as the prisms. They are developed in a specific manner in the lines. These are called as the lines of Retzius. These are called as the lines of Retzius. Okay, so we can find out here the enamel. After that, here there is the dentine. The dentine, it is present in three layers. The first layer, which is along with the pulp cavity, that is called as the predentine. Then there is a large layer present here, that is called as the circumpulpal dentine. And at the enamel dentine junction, there is another layer, that is called as the mantle dentine. Okay, so these are the three layers of the dentine. Here the predentine, then there is the circumpulpal dentine, and there is the mantle dentine. Okay, so this dentine, it is made up of number of tubules. Here you can find out there are the number of tubules. These are running in a specific manner. These are parallel with each other. These are running from the pulp cavity up to the dentine in the crown. and from the pulp cavity up to the cementum in the root. Okay, so these are the dentine tubules. These dentine tubules in the living, they constitutes the protoplasmic processes of the odontoblast cells. These odontoblast cells, these are the columnar cells present at the junction of the pulp cavity and that of the dentine. Okay, so here this is the tall columnar layer of the odontoblast cells. These odontoblast cells, their protoplasmic processes, they pass here through these dentine tubules. They are also running here through this for a short distance into the enamel and forming the enamel spicules. Okay, and they are also running here into the cementum. In the cementum, these protoplasmic processes, these are called as the granular layer of tomes. Okay, so these are the details present there. These are the macroscopic features present there. So let us see how much of these features we can identify in the slide of the tooth. Okay, again this is the picture present there. In the picture we'll identify the different parts here. So this is the enamel, the outer covering present here, that is the enamel. Here this is the dentine, and here in the center there is the pulp cavity. Here this is the apical canal or the root canal, forming here the root canal. Here the pulp cavity constitutes the blood vessels. Okay, so here these are the three layers present there. So we'll see that how these histological features look like. First we'll see here in the zoom what are the different parts. Okay, in the enamel here there are the growth lines. These are the lines of Retzius. Okay, then here these are the dentine tubules. These are the dentine tubules and the pulp cavity. Only these are the structures present there. In the root portion here there are the granular layers of tomes. At the junction of the pulp cavity and the dentine, here there is the layer of the odontoblast cells. These we have seen here, no? Cementum, root canal. Okay, so we'll identify all these features in the slide of the tooth here. This is the slide of the tooth. Here, this is the slide of the tooth. The slide of the tooth is very easy to identify as it is unstained slide. Okay, it is like that of the unstained, like that of the bone, but there is a much difference in between the bone and the tooth. We can identify very easily that this is the slide of the tooth. Okay, now the three different parts of the tooth. These are the main parts of the tooth here. Here, this is the outer aspect here. It is lined by the enamel. This is the main portion of the tooth. In the crown as well as in the root, it is formed by the dentine. Okay, so here this is the dentine, and here the central portion, the cavity, that is called as the pulp cavity. Okay, so we can identify here these three different parts here. Okay, enamel, this is dentine, and this inner cavity, that is the pulp cavity. Okay, so here in the enamel here, the cells, the rod shaped cells present there, these are the prism cells, also called as the prism cells. These are present in a specific manner. You can find out here the specific manner. So these are called as the lines of Retzius. Now here these are the dentine tubules. Dentine tubules, these are also running parallel with each other from that of the pulp cavity towards the enamel in the crown. Okay, so here this is the dentine material. Here this is the central core, the pulp cavity, it constitutes the blood vessels. Then the connective tissue, it is the mucoid type of connective tissue present in the pulp cavity. We cannot identify here this mucoid type of connective tissue, only these three gross different parts that we can identify, the enamel, dentine and that of the pulp cavity. Here this is the neck, here this is the part of the neck present here, and here in the this is the root portion present there. At the junction of this pulp cavity and that of the dentine, here there is the layer of the odontoblastic cells, but we cannot differentiate here these different layers. Okay, so this is the slide of the tooth. We'll see the high power of this slide of the tooth. Here this is the high power. It is showing here the pulp cavity and that of the dentine. In this picture, in this slide, higher magnification one can find out here. This is the pulp cavity and this is the dentine. This is the predentine. This brown color, that is the predentine, and here this is the circumpulpal dentine. You can find out here there are the number of tubules. These are running over here, and this dark brown, it is the odontoblast cells, layer of the odontoblast cells, but we cannot differentiate here the number of cells, that separate cells we cannot differentiate here at this much magnification. And here the protoplasmic processes, it runs within these dentine tubules. Okay, so this is the picture of the high magnification of the tooth. Again, this is the picture of the higher magnification of the tooth. Now this is the part of the root portion. Okay, so in this root portion also we can find out here this is the pulp cavity, here this is the dentine, and here this bone like tissue seen here, that is the cementum of the tooth. Okay, so this is the cementum of the tooth. Okay, so we have seen here the different parts. What we have seen in the slide of the tooth, that is the enamel. Then next part present there, main portion of the tooth, it is formed by the dentine. We have seen the dentine, the cavity, that is the pulp cavity we have seen, and in the root portion we have seen here the cementum. Okay, so here we can identify the slide of the tooth and the different parts of the tooth. Okay, so here this is the diagram of the tooth that you have to draw in the journal. Okay, so here also we will see what are the different parts here. So these are the different parts. Here the first is the crown. Here this is the crown portion, and here this is the root portion of the tooth. Okay, the crown portion of the tooth, it is covered by the enamel. So here this is the enamel. This is the dentato-enamel junction present here. This is shown here, dentato-enamel junction. They are the enamel spicules actually here. Okay, so here this is showing the division of that of the dentine and the enamel. Okay, now here the cavity of the dentine, it is the pulp cavity forming the central core. Now these are the dentine tubules running parallel with each other. These are also called as the dentine canaliculi. This is the central cavity. Pulp cavity is becoming narrow here, forming the central canal called as the root canal, and the dentine of the root portion, it is covered by this bone like tissue called as the cementum. Okay, so this is the picture that you have to draw in the histology journal. Next, we will discuss about the tongue. That is the last part that we are going to study here. The tongue. This is the tongue. The tongue is divided into the anterior 2/3 and posterior 1/3 part. Anterior 2/3 and posterior 1/3 part. The anterior 2/3 part, that is the oral part, and posterior 1/3 part, that is the pharyngeal part. We will see these different parts in this picture. These are clear cut demarcation is there. We can differentiate it very easily in this picture, that this is the anterior 2/3 part and this is the posterior 1/3 part. These are divided by this V-shaped sulcus called as sulcus terminalis. Okay, so here this is the pharyngeal part, posterior 1/3 part, and here this is the anterior 2/3 oral part. Okay, so for the to study the tongue, we should take the two sections passing through the tongue. The first section passing through the anterior 2/3 of the tongue, and the second section passing through the posterior 1/3 of the tongue. Okay, now this anterior 2/3 of the tongue, it shows the number of papillae. So it is also called as the papillary part of the tongue, and posterior 1/3 it is present in the pharynx and it constitutes the number of lymphoid tissue. So this is called as the lymphoid part of the tongue. Okay, so here the papillary part of the tongue and here the lymphoid part of the tongue. Okay, at the junction of this there is a sulcus terminalis. Just in front of the sulcus terminalis we can find out here there are the number of papillae, large papillae. These are the circumvallate papillae. Okay, so we'll see here the two sections. The first section passing through this anterior 2/3 of the tongue or the papillary part of the tongue. Okay, so here this is the picture showing the anterior 2/3 part of the tongue. Okay, so here this is the dorsal aspect of the tongue and this is the ventral aspect of the tongue. Both the aspects of the tongue, these are lined by the stratified squamous non-keratinized epithelium. Okay, so here this is the stratified squamous non-keratinized epithelium. This portion, it is also the stratified squamous non-keratinized epithelium. Okay, now this dorsal aspect of the tongue, it is irregular. It shows number of folds. Okay, so with these folds we can identify it very easily that it is the dorsal part. So these number of folds, these are the papillae. Okay, so these are the different papillae. So these are the pointed papillae which are present here. These pointed papillae present here, these are called as the filiform papillae. And these papillae with the blunt top or the round top, that is called as the fungiform papillae. Okay, so these are the number of papillae which are present on the dorsal aspect of the tongue, and the ventral aspect of the tongue are not showing any papillae. So this is the smooth part of the tongue. So we can identify here the dorsal aspect of the tongue and the ventral aspect of the tongue of the anterior 2/3. Okay, now these are the number of papillae here on the dorsal aspect and the smooth portion forming the ventral aspect of the tongue. Underneath this epithelium, stratified squamous non-keratinized epithelium, here there is the connective tissue. Okay, so here this number 2, that is showing the connective tissue. This is the connective tissue. Underlying the connective tissue here, one can find out there are number of muscles. As the tongue is the muscular organ, there are the number of muscles present here. The number of muscles, these are some muscles, these are running longitudinally, some muscles are running transversely. We are knowing that the number of muscles, these are the superior longitudinal bundle, inferior longitudinal bundle are there, some of the transverse muscles are there, some of the vertical muscles are there. Okay, so here that's why all the views of the muscles, that is the longitudinal section of the muscles as well as the transverse section of the muscles, can be seen here forming the main substance of the tongue. Okay, so here these are the different muscles present here. We can find out here the longitudinally cut muscle, here the transversely cut muscles. Along with the muscular part, we can differentiate here the another tissue. These are the glands. Okay, so here this is the longitudinal cut muscle. Here this is the transversely cut muscles. Along with these muscles, we can find out here these different parts. Here the part, this fourth portion present here, the 4 number, it is showing the serous type of salivary glands. And here this number 5, it is showing the mucus type of salivary glands. Okay, so here we have seen the number 1, it is showing the stratified squamous non-keratinized epithelium, or it may be the parakeratinized epithelium present there, forming here, lining the papillae. Number 2, that is the connective tissue present here, forming the lamina propria. This is the number 3, it is showing the muscle. Now here the muscle is cut longitudinally, here the muscle is cut transversely, but these are the muscles. Number 3, that is the muscle present here. This is number 4, these are the glands present here. These are the serous type of glands are there, and this is the number 5, these are the mucus type of glands are there. Okay, along with these glands here, there is the last number, the number 6 is present here in the picture. This is the adipose tissue. Okay, so we can identify here the number of structures seen in this picture. Okay, so this is the picture of the tongue passing through the anterior 2/3 portion of the tongue. This is the dorsal layer of the tongue, and this is the ventral part of the tongue. The dorsal and the ventral part of the tongue can be differentiated by this papillae present here. So papillae, these are the 3 papillae there. The circumvallate papillae are not present here in this anterior 2/3 of the tongue, as these are present at the junction of the anterior 2/3 and the posterior 1/3 of the tongue. So here this pointed papillae present here, these are the filiform papillae, and these round top papillae, these are the fungiform papillae. Okay, so we have seen the picture. Here we'll see the different papillae one by one. Here this is the filiform papillae with this pointed top. It is showing this stratified squamous non-keratinized epithelium. It may be parakeratinized, it may show the parakeratinized epithelium. Okay, so here this central core of the connective tissue extends into this filiform papillae. Here this is the connective tissue. In the zoom we can find out here there are the number of glands present here, there are the number of muscles present here. Okay, so this is the filiform papillae. This is the fungiform papillae present here. The fungiform papillae, it is with the round top. Here the fungiform papillae with the round top. Here the same epithelium is there, the stratified squamous non-keratinized epithelium. In the wall of the fungiform papillae, there may be the presence of the test buds. Here this is the core of the fungiform papillae. It is formed by the muscle, and that of the connective tissue extends into this fungiform papillae. Okay, so this is the fungiform papilla. Okay, so these are the features of the anterior 2/3 of the tongue. Now here the posterior 1/3 of the tongue, it shows the presence of the circumvallate papilla. The circumvallate papilla, it is the main differentiating feature between this is the anterior 2/3 of the tongue and the posterior 1/3 of the tongue. Posterior 1/3 of the tongue, it shows the circumvallate papilla. It also shows the presence of the lymphoid tissue. Okay, so this picture, it is showing the circumvallate papilla. So here the circumvallate papilla, we can differentiate the circumvallate papilla with the fungiform papilla, that the circumvallate papilla, it is not the projection from the surface of the tongue, but actually it is buried here. It is at the level of the dorsum of the tongue. Okay, so here this is the circumvallate papilla. The circumvallate papilla, it is a large papilla. It is surrounded from that of the it is separated from that of the tongue by that circular sulcus. Okay, so here this is the circular sulcus, and this is the wall of the papilla. This is the dorsal wall of the papilla. This is the side wall of the papilla. The side wall of the papilla, it shows the presence of number of test buds in it. Okay, so these are the number of test buds present in the circumvallate papilla. This is the circular sulcus present here. This is the largest of all the papilla. Here this is the dorsum of the tongue, and buried in the dorsum of the tongue here, there is the circumvallate papilla. There are only the 12 to 16 papilla, circumvallate papilla, seen in front of the sulcus terminalis. This is the main feature of the posterior 1/3 of the tongue. Now we will make it zoom here to see this test buds. Here these are the test buds. Here the central core present here, formed by the connective tissue. Now we will see here what are the structures seen here at the base of the circular sulcus. So at the base of the circular sulcus, you can find out here there are number of glands. These are the serous type of glands. These are the serous glands of von Ebner. These glands, they open here into this circular sulcus by the number of ducts. Okay, so this is the feature of the circumvallate papilla. We have seen the features of the tongue. Now we will see how these slides of the tongue looks like. Okay, this is the taste bud. This is the taste bud in the wall of the circumvallate papilla. Here this is the taste bud. This is the high power of the taste bud. This is the high power of the taste bud. These are the cells present in the test buds. There are the number of cells present here. These are the outer cells present there. These are the forming the capsule. Then there are number of receptor cells, supporting cells and basal cells seen in this test bud. Here this is the test pore present here. This is the basal portion of the test bud. Okay. So what we have seen here, the tongue. Here this is the anterior 2/3 of the tongue, showing the different papillae. Only the two types of papillae seen here, the filiform papillae, fungiform papillae on the dorsal aspect of the tongue. The ventral aspect is smooth. Here the muscles arranged in the longitudinal manner as well as the transverse manner seen here, along with the glands, serous and the mucous type of glands, and also the adipose tissue. Then we have seen here the filiform papilla with the pointed tip. This is the fungiform papilla with the rounded tip. The fungiform papilla is the projection out from that of the dorsum of the tongue, and the circumvallate papilla, it is buried into the substance of the tongue, separated from the tongue by the circular sulcus. In the wall of the circular sulcus here, in the wall of the circumvallate papilla, there are the test buds. Okay, so here these are the test buds. This is the high power view of the test buds. Okay, now these are the slides of the tongue, how these are looking here, what are the features that we have to identify here. Okay, so here this is the dorsum aspect, dorsal aspect of the tongue. There are number of projections present here, so we can find out these projections here. These are the pointed papillae here. So these pointed papillae, these are the filiform papillae, and these papillae with the rounded top, this papillae with the rounded top, these are the fungiform papillae. Okay, so we can identify here this dorsal aspect showing the projection of the papillae with the filiform and the fungiform papillae. It is lined by the stratified squamous non-keratinized epithelium. Underlying the epithelium here there is the connective tissue. Underlying the connective tissue here, these are the number of muscles. So the number of muscles present here, these are longitudinally cut muscles, these are transversely cut muscles present there. Okay, so we can differentiate here these pictures. In the slide we can find out these number of features. Here this is the anterior 2/3 of the tongue, the papillary part of the tongue with the papillae, connective tissue and that of the muscles. This is the next picture of again the anterior 2/3 of the tongue, showing this papillae, the filiform papillae. Again here there are the number of muscles present here. Here you can find out the another tissue. This is the adipose tissue seen here. This is the adipose tissue, signet ring adipose tissue present here. You can find out the number of glands, but here in this slide the glands are not there to show you. Okay, so this is the anterior 2/3 of the tongue. Now this is the posterior 1/3 of the tongue. In the posterior 1/3 of the tongue, that the main feature is the circumvallate papilla. So here this is the circumvallate papilla. Okay, circumvallate papilla, it is not actually the projection here, it is buried here, it is separated here from the tongue by this circular sulcus. Okay, so here this is the circumvallate papilla. In the wall of the circumvallate papilla you can find out there are the number of test buds. This is the central core of the circumvallate papilla formed by the connective tissue. Now in the floor of the circumvallate papilla, here you can find out these are the number of glands. These glands are the glands of the von Ebner. Serous type of glands are seen here. These glands open here into the circular sulcus by the ducts. Okay, so we can find out here these are the glands. Along with the glands, now here what other structures seen here? Now this is the lymphoid tissue present in the posterior 1/3 of the tongue. Okay, so you can find out here this is the lymphoid tissue. Now here these are the number of muscles present there. Okay, so these transversely cut muscles are present here. There are the longitudinally cut muscles present here. These are the lymphoid tissue present there. Then here again these are the glands present there. These are the glands of the von Ebner. They open here into the circular sulcus by the ducts. Okay, so this is the posterior 1/3 of the tongue. This is a high-powered view showing the circumvallate papilla, showing the number of glands. This is the deeper substance present there. The deeper substance of the tongue of the posterior 1/3, showing the glands. Here these are the glands. These are the muscles present there, and these are the lymphoid tissue. Okay, so we have seen here the slides of the tongue. Now this is the last slide. It is showing the picture of the tongue that you have to draw in the journal. Okay, so here this is the diagram of the tongue showing the filiform and the fungiform papillae. Here this is the filiform papilla and this is the fungiform papilla. Here this is the epithelium is the stratified squamous non-keratinized epithelium. Here the test buds are there in the wall of the fungiform papilla. This is the filiform papilla. These are the mucous glands present here. There are the serous glands present here, and there are the skeletal muscles as well as the smooth muscles. Here the skeletal muscles. These are running longitudinally and these are running transversely. Okay, so this is the tongue with the filiform and the fungiform papillae, and this is the tongue with the circumvallate papilla. Here this is the circumvallate papilla. Okay, circumvallate papilla. It is lined by the stratified squamous non-keratinized epithelium. It is surrounded by the rest of the part by the circular sulcus. Here this is the circular sulcus. In the wall of the circumvallate papilla, there are the presence of the test buds. There are the number of mucous acini and the serous acini of von Ebner glands are there. Here these are the serous and the mucous acini of the von Ebner glands at the floor of this circular sulcus of the circumvallate papilla. Again here in the deeper part there are the skeletal muscles. Okay, so this is the diagram you have to draw in the journal. Okay, so we have seen here the features of the lip, tooth and the tongue. Okay, that's it. Thank you.